start, sir.
Bismillahirrahmanirrahim. I am Dr. Arbab Abdul Wahid, Senior Lecturer in Forensic Medicine. Today I will deliver the lecture in the topic of regional injuries, especially the hide, bone, chest, heart and lungs. So I will start with the name of Allah. The topic is hide bone. Importance of hide bone in forensic medicine. You know that the hide bone is a U shape. It is placed in front of the neck and center. It has got one body and the two cornea, the greater and lesser cornea. The lesser cornea is a small eminence which is present at the junction of the body and the greater cornea. This bone, of course, under the age of 40, it is elastic and resilient and very difficult to be fractured by any violence. However, it can be fractured depending upon the force. While frequently fractured when the age is above 40 years, in which the bone is ossified and brittle, and any force or trauma may cause fracture of this bone at the level medial 2/3 and lateral 1/3 of the cornea. So the force or the violence which causes this fracture of the hide bone or the hanging or ligature around the neck or manual strangulation, that is throttling by hand, when the hand are placed in the neck and it is compressed. In hanging or strangulation ligation, the fracture, the force which resulted in this fracture, causing fracture, the force is anterior-posterior. That is, in hanging and strangulation, the force travel from anterior to posteriorly of this bone. In this way, the fractured bone pieces are displaced laterally, and the periosteum, which covers the posterior aspect of the hide bone, is ruptured. While in case of this throttling or manual strangulation, the force is inward, so the fracture ends are displaced inward, while the periosteum, which covers the outer surface of the hide bone, is ruptured. In this way, when a dead body is brought to you, you can tell that this, by the fracture of this, the force is anterior-posteriorly, it is a case of hanging, while if the fracture force is inward, that is manual throttling or manual strangulation, this bone is fractured. So in this way, you can explain these various sizes of fractures and violence which results in these fractures. Sometimes it is very difficult to diagnose this case even by X-ray, so you can examine the neck by giving incisions, and there may be some accumulation of fluid or hyperemia, or there may be hemorrhaging microscopically when seen. So when a case of suicidal or homicidal death is brought for the postmortem, when you see the structure of the neck, there will be the broken pieces of the hide bone. Either they are displaced outward or inward. There may be chymosis, that is infiltration of the blood in the surrounding structures, and also there will be on a microscopic examination, hemorrhaging may be seen in this area. So this is the hide bone and its medical legal importance. Next is the chest injuries. Chest injuries, any trauma over the chest or blow on the chest or fall of heavy object on the chest or in vehicular accident the chest injury is occur. It may be associated with internal viscera or may not be associated with the external, or vice versa. That is, blow on the chest may result injury externally, may not be internally, or internal injury occur but externally there will be no evidence. So careful examination should be done. You know, the chest wall is a very resilient. It can be compressed to some extent. When the chest, the ribs are elastic or compressible, and a force when is applied beyond its elasticity, then it may put a pressure on the heart, or concussion of the chest occur. By concussion of the chest, we means that there may be heart commercial-cordis. Heart commercial-cordis, that is the irregularity in the conduction system of the heart. So it may produce the ventricular fibrillation or auricular fibrillation, and death may occur even without any external evidence due to this cardiac arrhythmias. So at postmortem, you must take some section of the conductive system, especially the pacemaker, where you may find some microscopic hemorrhages. So death may occur with or without external evidence, or sometimes injuries to the heart. It is very difficult to differentiate it from myocardial infarction, because if the myocardial infarction occurs in first 24 hours, there may not be ECG changes occur, and you will be confused that whether it is myocardial infarction or due to the trauma to the this conductive system of the heart. So it is very necessary to take some sections of this conductive system for the examination. And when force is applied to the chest, X-ray should be done. Sometime it cannot be visible in the X-ray. The ribs fracture. The ribs are fractured either by direct violence or indirect violence. The direct violence are the blows on the chest, or stab wound, that is knife is introduced into the chest, or pressure by knee. When knee is placed on the chest and pressure is placed, or by bench dollar, that is putting some stick on the chest and do pressure. So these are the direct causes which may result in the fracture of the rib. While there are some other indirect violence or indirect causes of fracture of the ribs. These are the muscular contraction, violent contraction, and especially in violent coughing, and sometimes in convulsions. Say like in stitching poisons or other convulsive disease, when there are convulsions of the intercostal muscle, it may result in the fracture of the ribs. The ribs which are fractures are more prone to be fractured are from 4 to 8 ribs, because these ribs from 4 to the 8th ribs are attached anteriorly as well as posteriorly. And this attachment, when force is applied, there may be a bilateral fracture of the rib on both sides. Anteriorly fracture with this attachment with the costal cartilage, and posteriorly fractures when the ribs are attached with the spinous processes. So bilateral fractures when occur anteriorly as well posteriorly, also causing the knobbing fracture, called the knobbing fracture. This occurs in traumatic asphyxia, any asphyxia, or a bench dola, that is any stick is placed on the chest, or run over accidents, motorbike wheel or car wheel when passed over the chest, resulting in bilateral fractures. That is the knobbing fractures. Knobbing fractures, this usually occur in battered babies. बैटर बेबीज में जो इन्फेंट्स या बच्चों को बाजू से पकड़ के उसको वायलेंटली shake these children, violently shake, and this results in a knobbing fracture, anterior attachment and posterior attachment. When there are three successive ribs, when there are two successive ribs or fractures anterior and posteriorly, this is also called the flared chest, because the chest is collapsed at this level where the three ribs, successive ribs are fractures anterior and posterior, and producing a floating segment. This floating segment, it's sucked inward during inspiration. You know, normally when we take inspiration, the ribs are expelled outward or pushed outward. But over here, paradoxically, in inspiration, these floating segments are inspect inside and resulting in cyanosis or dyspnea, and then extreme cases result in hypoxia and death may occur. So complication of these wrist fractures, number one, collapse chest, that is flared chest, and may result in laceration of the lungs, and which may result in pneumothorax, that is accumulation of the air in the chest cavity, or the pneumothorax, that is accumulation of blood in the chest cavity, also resulting in pleurisy, or sometimes it may result in pneumonia, while it may cause injury to the chest or rupture to the vessels in the chest. These are the complications of the ribs. Understand these are points? Now come to the injuries to the heart. It's again a very important. These injuries to the heart may be due to the penetrating injury of the chest or non-penetrating injury of the chest. Penetrating injury of the chest, when any object is penetrated in the chest, maybe stray wounds or firearm injuries. These are the penetrating injuries which may result in the injury of the heart. Or some non-penetrating, that is any sudden blow on the chest, or any blow of a brick or a stick, or compression of the chest, of a steering wheel of the driver, or he may fall from height on the chest, which result in concussion or of the chest, or result in the contusions of the heart or infarction of the heart. In case of heart injuries, the ECG changes, which occurs in 24 to 48 hours, that is occur in the infarction of the heart. Sometimes a blow on the chest on front. This may result contusion of the posterior wall of the heart. This is called countercorp injury of the heart. It may be mistaken for the postmortem lividity and vice versa. That is, when the dead body is lies on posterior aspect, the blood is accumulated on the dependent part of the heart, that is posteriorly, which result in the postmortem lividity. So sometimes postmortem lividity may be mistaken as injury, that is countercorp injury, or the countercorp injury may be mistaken as a postmortem lividity in postmortem examination. When a blow occurs on the chest, which may result in the contusion of the chest, and that contusion results in the microscopic hemorrhages in the interstitial tissue of the heart, or there may be the myocardial fiber may be damaged. The mild to moderate contusion to the heart, it may result in the insufficiency of the heart, that is, death may occur in insufficiency of the heart, or it may result in angina pectoris, that may occur due to this, or sometimes auricular fibrillation may occur, or in some cases the valve of the heart may be ruptured, and due to this the death may occur. The commercial heart, or the commercial cardis, that is irregularity in the conductive system of the heart, that is in the pacemaker of the heart, and the contusions of the heart at right atrium below on the right chest during contractility. That is when contractility of the heart occurs, at that time when a blow or a blow impact on the chest, especially on the right side, it may damage or contusion of the right side of the heart, or especially the right atrium at its entrance of the pulmonary vessels. When there is forcibly fall on the chest of a driver in the steering wheel, may cause contusion or laceration of the heart. And now the question arises, how you will differentiate the myocardial infarction, that is disease, ischemic disease of the heart, from a contusion of the heart. In chest abrasion or bruises, if there is trauma, there may be externally bruises on the chest wall, or maybe some abrasions on the chest wall that should be examined externally. Then contusion on the heart, especially from right atrium and downward to the apex. There may be spotty contusion or lesion from the right atrium and passing downward to the apex of the heart. And if there is no previous history of heart disease or blood pressure, this is strongly suggestive of the trauma to the chest, or it is traumatic chest. The cardiac, this trauma to the chest also causes cardiac arrhythmias or hemorrhages in the heart, or it may result in the heart failure or rupture of the heart. If a doctor fails to diagnose at this stage the case of trauma and allow the person to walk, or he is not asked to admit or to take a rest, so he may die due to either cardiac arrhythmias or hemorrhages in the heart may occur, rupture of the heart, rupture of the valve, or heart failure may occur, and there may be pericardial bleeding may occur. So this will be a medical negligence against a doctor. So any case of blow the chest, or there are some ECG changes or some other changes in the heart, so such a person should be admitted under observation. Sometimes there is bleeding occur due to contusion of the heart, that blood is accumulated in the pericardial cavity, in which a lot of blood is accumulated in the pericardial cavity, and cardiac tamponade may occur, and pressing the heart, pressing the vessels, conduction not occur properly, and the circulation from the heart is failed. So if there are 200, 300 ml of blood is accumulated in the heart, it is very fatal, death may occur. But sometimes the blood, the penetrating injuries, of course it is very dangerous, but the accumulation of blood in the pericardial sac, due to any rupture of the heart, the blood, if the blood circulation is maintained, that is the valvular circulation is exist, so the death may be delayed. Understand this point? The blood is accumulated in the pericardial cavity, but this blood flows through the valve of the from atria to the ventricle. This is continued for some times, so the death may be delayed. Penetrating injury to the atria, according to the Moritz says that the penetrating injury of the atria is more dangerous than the ventricle. Why? Because the atriums are very thin and less contractile, so the less blood is pushed forward into the circulation. So atria, and first the right atrium, then the left ventricle, more prone to be ruptured by trauma in this sequence. Right atrium first, then the left ventricle, then the right ventricle, then left ventricle, and then the interventricular septum, and the valves are lastly more prone to be ruptures, and bleeding will more occur. So penetrating injury to the right ventricle is more dangerous, because there is blood is highly and a lot of blood will be lost. So the common site of trauma, rupture heart, as Mother Moritz, that is the right atrium, left ventricle, or right ventricle, left atrium, then the interventricular septum, and the valves last. This is a state wound, in the picture. the knife is introduced in the chest, and it may injure the various, in the X-ray you say there is a population of some fluid as well as a pneumothorax, the heart whatever is pushed on towards the left side. Again, the ribs which are fractures, flare chest from second, third, fourth, 3 segments are fractures at these regions. In these pictures, these are also the stating and the incised cut of the chest on the most lower left side. There may be firearm injuries, and the chest wall condition you never see in the pictures. And now come to the injuries to the lungs. Injuries to the lungs may occur with or without fracture of the ribs. Sometimes there may be the trauma to the lungs by any blow of the chest, even without external injury. This injury to the lungs varies from simple abrasion, bruises, to a massive lungs rupture or collapse of the lungs. In the children, you know, the ribs are elastic and flexible and resilient. So this elastic rib cage may be, in the young, may be compressed and resulting in injury of the lungs or without fracture of the lungs, which result in contusion of the lungs, which may occurs in hemorrhages. So any blow over the chest results in subpleural hemorrhages, or this blow or pressure may compress the alveoli. There may be compression of the alveoli and resulting in rupture of the alveoli, or intra-alveolar hemorrhages may occur. So any impact on the front or in front of the chest or side of the chest, any blow, अगर कोई मुक्का लग जाए छाती के सामने या साइड पे, it may result in the contusion on the posterior aspect of the lungs, which is also called countercope injury of the lungs. So it may be again mistaken for the post-mortem lividity or vice versa. Any step wound, when a knife is introduced in the chest, stabbing chest, this may result in the entrance of air in the pulmonary veins, and these pulmonary veins, this air embolism, that air which is collected in the vessel, it is called air embolism, like the fatal embolism, like the bullet embolism. This air embolism enter in the coronary vessel or in the cerebral vessel, where it may cause ischemic heart disease or CA in the brain. So on post-mortem, you will see that there will be segmented blood, that is air column blood, then air column blood. So this is segmented column of the vessels. This indicates the air in the pulmonary vessels by introducing a knife in the chest. So in this way it may results in a complication of the chest, that is lordosis. The chest cavity is full of air, and the emphysema of the mediastinum, that is the air in the mediastinum, or in the subcutaneous area of the chest, there may air come, which is called subcutaneous emphysema. This result in bulging of the chest and forward, which is called lordosis. Similarly, there will pulmonary emphysema occur, and early death may occur due to the hemorrhages and asphyxia. Postmortem, in such a case where there is air in the chest, in postmortem, the chest should be open in water. That will tell you that you will see their air bubble will come. This has a great medico-legal importance. It means that the person was alive at the time of this injury, or pneumothorax also, or this the emphysema of the chest also indicate that the person was also alive at that time of receiving this injury. So these, you can say that these are the antemortem injuries. Sometimes blast explosions, बम धमाका होता है जिसकी वजह से multiple these waves, the blast waves travel in the air cavity, जैसे कि in the air में, in the heart में, in the lungs में, brain में, जहाँ भी air cavity वो burst हो जाती है. So these blast waves may travel the lungs and the fibrous tissue may be injured, and there occurs sometimes during this stage, and the aspiration of the gastric contents may pass in the lungs or similarly in drowning. Such a case is called ARDS, that is Adult Respiratory Distress Syndrome. By the Adult Respiratory Distress Syndrome, we means that there is, it is characterized by the fibrosing alveolitis, that is alveoli में fibrosis बन जाती है और वो एक rigid structure बन जाता है. In the alveoli there will be albuminous fluid, and in between the alveoli the interalveolar septum is thick, lungs is rigid, hard and non-edematous, and this is called ARDS, that is the Adult Respiratory Distress Syndrome. This occur in number 1 blast waves में blast हो जाए नीचे इससे. number 2 paraquat poison में, ये जो एग्रीकेमिकल पॉइजन है जो खेतों वगैरह में जो वो जहर वो प्लांट्स पे डालते हैं, इंडरीन हेप्टेट वगैरह, वो अगर गलती से या कोई सुसाइड कर रहा वो पी ले तो उसमें भी ये आरडीएस होता है. या इन सेवर गैसेस में, जैसे कि गैसेस होते हैं सेवर्स की, इसमें अगर कोई आदमी चला जाए उससे भी आरडीएस होता है. सो द कॉजेस ऑफ आरडीएस इज this blast waves, paraquat poisons, sewer gases, and also in near drowning, yeah, gastric contents are aspirated in the lungs. It may develop this ARDS. Bismillahirrahmanirrahim. Today, now we will discuss the abdominal injuries. The abdominal injuries may be blunt injuries, that is by any kick or any brick or fall on the ground or any blow on the abdomen are the blunt injuries. While the abdominal injuries may be caused by knife or some dagger and passed in, or maybe by the firearm injuries. Now the blunt injuries are abdomen. When a blow occur on the epigastrium, किसी भी के पेट पे जो एपिगेस्ट्रम में मौका या ठुडा लग जाए, this may cause sudden death. Suddenly वो आदमी मर जाएगा. This is why, because of the vagal inhibition. Any blow on the abdomen which occurs and it may cause vagal inhibition, sudden death occur. On postmortem examination there may be no any external sign of injury, or even intra-abdominal there will be no any injury except the large colon are abnormally distended, that is paralysis of the vagus nerve. Second is the contusions of the heart, contusion of the over the epigastrium, or contusion of the mesentery or liver, spleen. फिर इसके बाद rupture of the stomach, फिर इसके बाद laceration of the kidneys and rupture of the abdominal vessels. So, sometimes there may be an external sign, bruise, abrasions, or inflammation or swelling, or sometimes there will be no any external sign of injury, everything will be inside. Next come blow on the stomach. अगर stomach पे कोई kick और कोई मौका या ठुडा या कोई लाठी पत्थर लग जाए या वो fall में on the epigastrium, so it may rupture of the stomach. Stomach may be easily ruptured when it is full, or it may be ruptured when anesthetis, the endotracheal tube wrongly passed in the esophagus and that tube is collected in the stomach. Or in case of drowning, when the person is drowned in the water and the stomach is full of water, so या अगर स्टमक पहले से कोई डिजीज हो, अल्सर हो, that is stomach may be more vulnerable to be rupture. So any blow on the stomach or anesthetic tube or inhalation of water in cases of drowning water, or the person is fall in the water on the stomach in case of swimming. अभी स्विमिंग कर रहा हो और वो फॉल हो जाए abdomen पे, तो it may result in the rupture of the stomach. So in such all cases you must exclude the peptic ulcer, because the peptic ulcer may come forth of the trauma, and then that time it will be very difficult. The death is either due to this traumatic rupture or the ulcerative ruptures. If a person has an ulcer, any pressure or any blow on the chest, this ulcerative rupture occur along the lesser curvature. It runs along the lesser curvature. This occurs when there is already ulcers. While the traumatic ruptures, it occurs from anterior wall, passing the lesser curvature and passes toward the posterior wall. So the ulcerative rupture is along the lesser curvature, while the traumatic rupture from anterior wall of the stomach towards the posterior wall and crossing the lecture. So this case rupture occurs, traumatic rupture and anterior posterior rupture of the stomach. There may be submucosal hemorrhages in case of this traumatic rupture. The mucosa will be elevated. Under the mucosa, submucosa, there will be bleeding, and submucosa will be raised above. While in ulcers, if ulcer rupture, the mucosa is indurated and strongly adherent to the underlying structure, and there will be puckered adhesions in case of this ulcerative rupture. So these are the abdominal various injuries showing the abdomen, including the stay wounds and some ulcers, and the abrasions as well as inflammation over sites, and the cuts are there. And this is the mesentery which is coming out, right? And this all about that. Now come to the intestine ruptures. Any blow or blunt force when applied to the abdomen, there will be rupture of the mesentery, or intestine may be ruptures. In case of stay wound or fire, the intestines are ruptured at several levels, and there may be collection of some fluid or blood in the peritoneal cavity. And this is about the stomach.